All right, Allison, thank you so much for joining us on the patient story today. Really appreciate it.
Thank you so much for having me.
We are so interested in getting to know your story, what happened. So let's just dive right in. As every one of us former patients goes through, it's the what happened? What were the first symptoms? Something was wrong. Can you describe that time for you?
Sure. I was just your average person living life to the fullest, working, having fun with my friends. I actually have Crohn's disease. So I'm really I guess, in tune with my bowel habits. And I sort of have taken all sorts of medicine. At that point, I had been in remission for quite some time. So a year and a half earlier, I'd had a very clean, probably the cleanest colonoscopy I'd ever had in my life. I was in the best shape of my life. I was eating well, like working out. Usually, I think I would say 5 to 7 times a week. And over the course of a few months, I started noticing subtle changes, weight loss that I really thought was from the Zoom I was doing. But then there was severe fatigue. Then there was increased blood in my stool that I hadn't ever really seen before. But the biggest symptom, I think, for me was the fact that I felt like when I ate, something was getting stuck in me. And I had never had a blockage in my life for any reason. And so I was like, well, maybe it's something like that. I don't know. Um, sorry. Making noises on my phone.
No
Um,
worries.
are you editing this? Sorry.
It's gonna be just this video. It's okay though. It's like a normal conversation. So go for it. Yeah.
Okay. Sorry. When you're home working virtually, you get
Yeah,
all sorts of notifications, and I thought I'd turn everything off.
we get that.
Um, so back to sort of I was having these symptoms that sort of were unusual for me, and so I scheduled an appointment with my GI doctor, who I was very lucky that I had a GI doctor. And so I was supposed to have a colonoscopy later, like maybe a year later. Because of the symptoms that I was telling her, she, instead of scheduling a colonoscopy right away, she had me drink, some of the stuff that helps clean you out to see if maybe I had a blockage. She did an x-ray, and I drank some of that stuff, and I felt maybe good for like a day. And so that was alarming to her. So she scheduled a colonoscopy for a week after that. And I remember waking up, and she said, I found something. I don't know what it is. I don't think it's cancer, but we took some biopsies. So, that's sort of what led up to me getting screened, those symptoms, but also I think me being my own advocate is probably the reason why I got the screening that I needed. And also knowing my body really well. A lot of people don't necessarily pay attention when they go to the bathroom, but I did.
Right, because you've had Crohn's disease experience with all this, and you had the routine colonoscopies. By the way, can you describe a colonoscopy, what it's like in human terms for people who haven't had one yet?
So in human terms, it's not the most pleasant experience. I'm not gonna lie, but I sort of treat it as like a clean out, a full clean out of your body. So it's one of the screening methods for GI doctors to see if anything's going on in your colon. So essentially, you have usually a day or two of clear liquids, and then the day before the procedure, you have to drink this. It's called a bowel prep. You have to drink some sort of prep that cleans you out. And when I say cleans you out, it's very similar to if you go and get a colonic. You drink this stuff, and you go to the bathroom, so that by the time you're done drinking, the only thing that you can see is very clear liquids that are coming out when you go to the bathroom. And that's so that when a GI doctor goes in and does a colonoscopy or a scope, they put this device up to look in your colon to look for abnormalities, any sort of inflammation, any sort of polyps, any sort of redness or irritation. And they can only do that if you're clear. There's nothing that is blocking their view from the insides of your colon.
And do you go under for that? Is it just local, like
Oh, it depends. I always insist on having anesthesia. I One time I had a colonoscopy without, and I felt it. There is like local anesthesia, and then there is a more advanced type of anesthesia you can get. That's like sort of options you talk with your doctor about. And I always insist on getting that because I don't want to feel any pain. And there's extra precautions with that. They have an anesthesiologist come and talk to you. but it really is based on your provider and what they suggest. But personally, without giving medical advice, I always want the anesthesia that will put me out so I don't remember, because I essentially wake up after and I've felt no pain and I don't really remember anything that happened to me.
Right. You're basically sleeping the
Yeah.
entire time. Okay. Um, then your doctor took some biopsies during that colonoscopy, take some samples. Do you remember how long between the colonoscopy and by the time you got the biopsy results, just approximately how long that was?
I was 2 days. 2 days later, I got the colonoscopy, and then 2 days later, I got a call from my GI doctor to come to her office so she could give me those results.
And before you go into the results, people who aren't familiar with the process, the wait sometimes can be one of the hardest parts too, right? Can you describe that?
Um, that wait time was probably on the top 5 list of most stressful things in my life besides cancer, because, mentally, I don't know, not everyone hears, cancer when they wake up from a colonoscopy. Some people are diagnosed during that colonoscopy, right? It totally just depends. She mentioned the word, you might have, I don't think it's cancer, but I did some biopsies. Some people that day of the procedure get diagnosed, but anyone that has to wait for any sort of results, I dived into work. I tried to distract myself. I kept myself busy as much as I possibly could. But in the back of my mind, I'm hearing cancer, cancer, cancer. And it's the fear of the unknown. Your life is in the hands of somebody else and not yours.
That's so well put. The control thing is really difficult to handle. So, Allison, 2 days later, you are told, come on into the office. Can you describe what happened?
Um, well, she had never called me before. So the fact that she called my cell while I was at work during the middle of the afternoon, I get the phone call and I know, like, she didn't even have to tell me. I know that I'm about to go through the worst journey of my life, the biggest challenge I've ever faced. And so I get on my walk over to her office from work. I leave everything. I work in a research lab, so I was in the middle of a project, and I told one of my friends, "There's an emergency. Could they take over?" And I walked across the street, got on the phone with my mom, and was crying. And I got into her office. They put me into a separate room, and that's when my life changed forever. And I was told I had stage 3. At that point, I was told I had stage 3 colorectal cancer, and I should try to find an oncologist and surgeon as soon as possible, because I had had that colonoscopy a year and a half earlier that was clean. They thought it was pretty aggressive.
Wow. Okay. So yeah, it's like you knew going in, but to have to hear it at that moment, put into actual words, how did you process, or did you not?
I don't think I did. I think, like, for, maybe a minute, my life flashed before my eyes, because I had experience in my lab with different cancers and whatnot that I did as far as research was concerned, but I never thought cancer would happen to me. So I really just vividly remember flashbacks from when I was a kid to like a day earlier, or like a week or a month or a year earlier, to all these great times I'd had. And then I kind of like stopped myself from that and realized that, okay, I'm tunnel visioned. I need to do what I need to do in order to find doctors so that I can get this cancer taken care of, out of me, and prepare myself for the fight of my life. So it's really like fight or flight, in a way. I I think I could have gotten to, I mean, I was sad. Don't get me wrong. I cried probably for days after, and even hours after, and even while I was sitting there. But I think that I knew that I was young, I was healthy, and I was strong, and I could get through this.
Right. How old were you when you were diagnosed?
I was 32.
Wow, yeah, so very young. And like you said, there's a switch that kind of comes on. You're still grieving the news, but you're like, well, I've got to do this, right?
Yeah.
No other choice but to move forward. I want to ask you, this GI doctor is like, all right, well, you're gonna have to find an oncologist and a surgeon. I mean, this is one of those things that I think people have a tough time with too. It's like, where do I go? How do I look? Do you have, after having gone through the experience, I mean, do you have any guidance or any,
Um,
yeah.
yeah, so I mean, I'm a little bit different because, like I said, I work in the Texas Medical Center. So, I went home and I processed the information. We told people, and really, what I did was I asked friends, I asked colleagues, I asked people that I knew that had any sort of experience with cancer about the best institutions possible. And then, I said I got as many opinions as I could get. I got 3 opinions at different institutions, and let me tell you that maybe the treatment was similar, but the surgical options were very different. And I also knew of a friend who I had thought had just gone through colorectal cancer treatment. And so I reached out to my friend to connect me with this person because I knew nobody that had colorectal cancer. And I definitely didn't know anybody young. And this girl was a year younger than me in my high school in Houston. And so I reached out to her, as well as my best friend who worked in cancer research as well, to try to get as many opinions and options as possible. And yeah, it's one of the hardest things because you want the best care. But I tried not to go to Google. I tried not to go to Google because there's too much information. There's too much out there that possibly could be unreliable. That I really tried to find people that knew people that had gone through any sort of cancer and ask them, okay, who do you suggest? What do you think? And I took tons of notes. I was just lucky that someone that had worked in my research lab was working in colon cancer and GI in the GI department at MD Anderson, so they had a suggestion for somebody. I worked at Baylor College of Medicine, so I knew people at Baylor that could help get me in. I had previously had a GI doctor at Methodist because I literally went through GI doctors like crazy. They would fire me at any point multiple times because my Crohn's was a beast to handle at times. So if you don't have connections, reach out via social media to maybe someone that knows somebody. Because when you're diagnosed with cancer, people just want to help you. And one way that people can help you is to, give you suggestions on people who to see and who best to help you than someone that's gone through the journey themselves.
Absolutely. No, that's exactly right. I agree with that. It's hard when you don't have a network, but you can try to reach out and see if there's a connection of a connection of a connection. Um, so you figure out where you want to go. By the way, what was it that made you want to go to? Did you?
Um, yeah, so I was treated at MD Anderson,
Right.
and what made me all the hospitals I went to were amazing. All the doctors were amazing, but it was one thing that my oncologist said to me that made me want to go to him, and it was, Allison, you are young. I don't want you to feel like you're just a number. I want to make sure that you understand that I am caring for you and you only. And when I'm looking at your chart, your treatment plan, it's personalized for you. I don't want you to get lost in the cracks. Here is my cell phone number if you need anything. And
Oh,
that was in 2012. And I have yet to use that cell phone number, but that level of, like, I want to say trust that he had in me made me have that in him. I don't think every doctor would give their cell phone number to a patient, but I think he knew that I wasn't gonna, hey, what's going on, call him all the time. But I think that, in these big institutions, these big cancer centers, you get a medical record number and you feel like you're just, one in a million people that's being treated there. But knowing that he wanted to ensure that I would not get lost in the cracks and my treatment and my case and me as a person mattered is why I went to that oncologist and started treatment at MD Anderson.
yeah, it's powerful. No one wants to feel lost in the cracks and part of the crowd. So I'm glad you found the right person for you. When you met him and he said that, and then you I imagine then had like a first real appointment with him where he laid out what exactly he felt was right for you for the treatment. So what was that?
So I had an appointment. That first real appointment was with my oncologist and my surgeon. And so standard of care for someone with my diagnosis was going to be 5.5 weeks of combination chemotherapy and radiation, a little bit of a break, then surgery. And surgery could range from so many different things. It just depended on what they found inside. But surgery and then chemotherapy again. And that's sort of like very, very, very broad. but that's sort of what standard of care in 2012 was for colorectal cancer. And I say colorectal cancer because my tumor was in not only my colon, but it was also in my rectal area. So it was a 13-centimeter tumor that they found that wasn't just in one, it was one tumor, but it wasn't in one organ or part.
Gotcha. Okay, so yours is colorectal cancer
Yeah.
categorized. Okay. And then was the staging shifted?
Yes.
Yes.
So I went through the radiation and chemo without knowing anything. So that's another fear. You don't know, like I had my scans, obviously, but I had no idea that cancer is growing in me. Is it not growing in me? You have no idea if your treatment is actually working. It wasn't until I had my first surgery after that in September that I was opened up and they realized the lymph nodes that they thought first were involved were only inflamed. It was just inflammation. It had not gotten into my lymph nodes or spread in my body. So I was then downgraded to 2C, which is better. Obviously, it's always better to be downgraded than upgraded, and it's rare that happens. But so that happened to me. But also when they did surgery, they, because I had Crohn's since I was 12 years old, the amount of inflammation that they found in my colon, they said when they opened me up, my colon sort of fell apart in their hands. So my surgical wishes were to have a J pouch if possible. I did not want to have an ileostomy or a colostomy if possible. Well, since they took my whole colon, they couldn't do a colostomy bag, but they could do a temporary ileostomy and take what was left of my inside. I'm using my hands, but take what was left in my abdominal area, stretch it to make something called a J pouch, which when the recovery is sort of to let that heal. That's why they let you recover from surgery before they do chemotherapy. Again, let that heal so that your body can sort of get used to your new organs again,
Right.
and your digestive system could start working again with a lot less time from when you eat to you get rid of whatever waste you have.
Right. And I do want to get into all that into a little bit more detail. I do want to go chronologically so people understand your process.
Sure.
It says, so you had the diagnosis June 7th, and then about 20 days later, so about 3 weeks later, you started the chemo/radiation regimen. Can you describe in detail what that meant? I mean, especially the way you would describe it to someone who's about to go into the treatment.
I mean, my chemotherapy was I want to say easier than others, but it was not IV chemo. It was a pill chemo. I still had lots of different side effects, but so the same time I was going in for radiation every day, I was also taking this chemotherapy drug, and it's sort of to tackle the cancer two different ways at once. And so radiation is every day I was working throughout all this, but at 5:30 p.m. I would go over to the hospital and they would they tattooed me when I was first diagnosed, and they would have I would get radiation to my abdominal area targeted towards specifically targeted to where my tumor was, and at the same time I was taking this chemotherapy. So the side effects from that can range.
Let's break it down first. So the chemo pill, this is an oral pill.
Yeah.
Did you take it every day, the same time? Was it?
Yeah, it was regimented. It was quite a long time ago, but I think I took it once a day, and I took it throughout the whole time I was doing my radiation.
Okay.
I'd actually have to probably go back and look at my records to see, but they might have ended it a week earlier than the radiation because of the side effects I was having. My neuropathy got quite bad. Nausea was really bad. You go in often to see your doctors to sort of see if you need to continue on, if the side effects are really worth your quality of how you're living, because really at that point, while I had started, I had been diagnosed and I had started my chemo and radiation, I was gradually losing a lot of weight. And in order to really, I guess, do well during any sort of cancer treatment, you have to have some weight on you to be able to fight the effects of all the drugs that you're having to take.
Gotcha. Okay. The side effects were really bad, I'm hearing. And do you remember the chemo pill name? If not,
It was called Xeloda.
Xeloda. Okay. So the side effects got so bad, is the neuropathy was really bad for you. What was the best thing that helped you either prevent or lessen the side effects, if anything?
Um, I mean, it's sometimes it's hard to lessen side effects. They can give you medicine for some of the side effects, but then there are side effects from those side effects. So really trying to figure out what worked best for me. It's sort of personalized for everybody. So some people gave me, you know, gloves to help with the cold and hot sensitivity. Some people, I was taking anti-nausea meds. I was taking meds to help me sleep because sleep would help. um, I think that it was sort of one day at a time. You can't really combat. It's a little embarrassing, but you can't really control your bowel habits at one point towards the end of that radiation because it's pumped into your body. So
Right.
whatever tools I could have in my, in my bag of things to help, I used. It was a lot of talking to, like I said, I got a lot of like talking to other survivors and patients that helped me figure out what would work best. They told me invest in adult diapers. So I did. I am invested in adult diapers, and I want to say the last few weeks of radiation, I had to wear those because it's very hard at that point to control your bowels, the radiation and what it's going to do to you. The first few weeks, 2 weeks, it was fine. And I was like, oh, this is no big deal. I'm going to be fine. But it got tough. It got really tough towards the end.
Yeah, I appreciate you sharing that because, this is all about just, hey, look, this is part of the process. These are things that happen. I mean, your body is getting radiated in that area. So, of course, there are going to be side effects. Can you describe any more about, so the process of going into radiation, you'd lie down there, how long it would take? And then if you want to just, I know you shared some of the side effects, but, feel free to detail some more for people.
I'm trying to sort of think. I think that the bowel habits also. So the one thing they don't necessarily tell you, or they really don't necessarily explain as well as I would like, and they're much better about it now, is the radiation also causes, depending on where it is, burning. This is essentially radiation to your skin. And so like I'm trying to think of a way to put it in terms that a woman or man will understand. Essentially, your personal parts are could be red, could be irritated, could get blisters, and there's creams that I can't remember all the names of the creams that my doctors would give me, but I knew that the burning and the redness and all that would eventually get better, but it was very painful to go to the bathroom anyway.
Right, right. And then for you, you said things that helped towards the end were diapers, and then there's these creams. Anything else you can remember that were helpful?
Trying to think of um what else I did during radiation and chemo. I mean, I think that what I'm putting in my body made a difference as far as, eating. I think that I asked my doctor to refer me to a nutritionist, so I know that what so I could know better what I was putting in my body would sort of help combat what was essentially coming out. Because you sometimes you have Kegels. They told me to do Kegels. That's one thing I just remember. They told me to do Kegels, and they say that, and people are like, I don't have to do that. Oh my gosh, life saving, life changing. They really make a difference when a doctor says to do something. If you don't want to or you don't quite understand, ask why. I was very much like that advocate, that patient that was like, okay, well, why do I have to do this? And once they explained it, then I was like, okay, 100%, I will do it. But you get so much information all at once that you think you can ignore something, and it turns out to be one of the most important things you can do to help with your long-term side effects.
Allison, how did the Kegels help you with the exercises?
I mean, they just help me control that part of my body later on in life, and sort of throughout the treatment. They said to do it, and I didn't necessarily believe it until these muscles aren't necessarily being used, and they also are being affected heavily during your treatment. So it's like if you don't use it, you lose it. So the more you use it and the more exercises you do, the better outcomes long term.
Gotcha. Okay, that makes sense. And I'm seeing, so this treatment with the chemo and the radiation, the oral pill, the Xeloda, and then the radiation, which you had 5 days a week the
Yeah,
entire time. Okay. That was for many weeks, it looks like.
5.5 weeks.
5.5 weeks, right. Okay. And then at the end of that, how are they assessing when to go forward with surgery? Did you get a scan?
Yeah, yes. No, I did not get a scan. No, I didn't get a scan. They just, I guess, based on their research and, since it's the standard of care, they knew about how long your body needed to recover in order to go in for surgery. So there was no scan in there because they didn't want to give me any extra radiation to my body because I had just been obviously heavily radiated.
Right, right. And so they gave you about a month break, I'm saying, before they had the total abdominal colectomy.
Yeah.
So, okay, so you had mentioned the surgery before, but let's really kind of go in now. Do you remember the prep before surgery?
I mean, yes, you go in and they look at your heart and they review the anesthesia and they review all the surgical options. Because as in most cancers, there's you know they don't know what they're going to find when they go in, so they could do this or they could do that or they could do this. The other thing, so that's sort of surgical things that they review all the different options they can do with you. But then there also was this is like crazy to talk about now, but back then it was a very emotional night. My God, I'm gonna cry. And I don't cry anymore.
Mm.
My parents and I sat there and filled out my last will and testament and what would happen if I didn't survive that surgery. Sorry.
No, no.
I mean, I tell my story so publicly so often, but that one moment, the night before my surgery, filling all those forms out, thinking that I might not make it off the operating table was tough, but much needed because I knew as a former, I worked in research. As a researcher, I knew that if anything happened to me, if I had organs that could save someone else, I wanted them donated. And the little possessions and stuff that I had, I knew where I wanted to leave them and what I wanted to do. So that moment was just, it was a true, real, emotional moment. Sorry.
No, don't apologize.
For me and my parents. So that's something that
Yeah.
I think is a requirement when you're going into, a surgery like I had. But it's a real moment that can be a struggle for anybody. I mean, you have the fear of the unknown, but then you're also filling out these forms in case of, and it's scary for anybody, but especially somebody young.
Right, you were so young at the time, and for anyone regardless of age, just that prospect of, okay, I'm going into a very major surgery, and I know my medical team is great, but look, there's always this unknown. Can you actually, I appreciate you getting into this really more personal part, because I'm sure this is such a human reaction, right? Everyone who's about to go through such a major operation, is going to be thinking and feeling these things. Allison, what would you like to say, to other people who maybe are in this moment right now?
I think the physical readiness is important, but also the mental aspect of it is really important. The first appointment I had with my doctors, my team, I asked to speak to a psychologist, and that's the same time that I asked to speak to someone that had gone through treatment that sort of knew what I was going through. And I think psychologically, I had talked to not only a professional but also a human being that had gone through it. So that helped me mentally prepare for what I was going to wake up to, or not wake up to. I think that you don't know. I had never had really any major surgery in my life, so not knowing what was going to actually happen. Was I going to have drains? Was I going to have a tube? NG tube? Was I going to have this? How my life was going to change. I think I had to, like I said, physically, obviously prepare, but the mental aspect of it, I wanted to go into it as mentally able to handle whatever I was going to wake up to.
I'm so glad that you had the foresight to get that help beforehand. Was that is emotional for you too, just thinking about because you had to have this conversation also with your parents and being so young? I mean,
Yeah, it was emotional. I think so my mom's a breast cancer survivor, so when I was a teenager, um, we sort of all had to chip in and were her caregivers along with my dad. So I'd had a little bit of experience with cancer, and when I was first diagnosed, my mom was obviously crying just like I was, and she said, "I wish it was me because probably of my age, you know." And I remember clearly saying to her, "Well, I don't wish it was you. You already went through it once, and I'm strong and I can handle this because I have you guys." And I think that my parents, were forced to be strong for me. And also I wanted to be strong, but I also needed to be emotional and cry and just let all that fear out. Because if you at least for me, if I had kept it in, it would have probably negatively affected the treatment and my path to getting better over time.
absolutely. I'm glad you had your support system in place. So again, thanks for sharing that. So okay, so you signed everything, you've discussed these plans, and then the actual surgery happens. Do you remember how long it was, and remember waking up from it and recovering?
Yeah, I think it was 14 hours of surgery.
Wow.
It was very, very, very long. As you can imagine, it those surgeries are complicated. They get a lot of people involved. So it was, I think, 14 hours, and I think every 2 or 3 hours they go out and tell my parents. And what was funny is that I don't remember a lot of, and I'll tell you a little bit about what I woke up to and how I felt after that. But I just recently went back, so I had a huge support system, friends and family that really wanted to know, get updates about what was going on the whole time, and I knew I wasn't going to be capable of doing that. So I created an email list, and I think this is helpful for all patients. I created a listserv essentially of all the people that wanted to have updates. And my dad was put in charge of updating people. So as he got an update from the surgeon or the surgical team, he would then in turn send not the exact same update that he got, but an update to the people that cared about me and the people that wanted those updates. And so it took the burden off of me and my mom, who's very emotional like I am, to update people, because getting constant phone calls was the last thing that myself would need after surgery, my mom. And it's stressful for everyone involved, the patient and the caregiver. So those constant updates they were getting, they in turn were sending out to my support system so that they could sort of send their messages, and then my parents would read that to me. So I remember waking up from the surgery, and I was actually in like a holding room. It was like a pediatric. There was pictures of, I think, Disney characters all around me, and that's just happened to be where they put me for the time being. And so I woke up to my parents, and I was very, very groggy. Um, I had they'd given me an epidural for pain management, which we had talked about before. So I was you know told that it would be used. The problem was that it was used, but it was only successfully able to work on one side of my body, and it happened to be not the side where I had gotten a temporary ileostomy. So I woke up, I was groggy, I was in extreme pain. There was tubes all over, drains all over. I had an NG tube. I had, you name it. If there's a opening in your body, I had a tube in it. Um, so I moved finally to my permanent room, and the main things that I remember are looking down and seeing staples, seeing this foreign object to me, which was an ostomy bag. And at that point, I was told that they were able to create an internal J pouch, and I had this temporary ileostomy that they'd have ostomy nurses help me with. That their goals for me were to get the pain under control and to get me up walking, because sooner I walked, the better my recovery would be. So it was the most pain I've probably ever been in my life, and probably ever will be in my life, I hope.
Okay, so yeah, very painful because your body's like been shifted around inside and trying to just get used to it, have things settle. Can you describe, I'm unfamiliar too with, the ileostomy bag and all these different terminologies. In layman's terms, especially for someone who is about to, again, maybe go through this or have the prospect of these different options, what does this mean,
So, you have, like I said, multiple possible surgical options. Sometimes you get laparoscopic surgery where they can just do a colon resection. But due to my Crohn's and my history of inflammation in my colon, they had to do an open surgery. So essentially they cut me, and I think from mid chest area all the way down to, all the way down to the very tip of my vaginal area. And so they opened me up, and so with me, like I said, they realized that they couldn't just do a colon resection. But in order for any surgery to heal, usually, and I say usually, depending on your stage, it's different. I mean, I know my colorectal cancer surgical options, but stage 1, 2, 3, 4, all that treatment's different. But at that point, like for me, and quite a few people usually with rectal cancer. So since my tumor was in my rectum as well, a lot of the like sort of standard surgical standards are they take, part of your inside, and it's an opening on either your right or your left side, and they call that a stoma. And it's like a diversion from, from your intestine. It's called a stoma. It's so hard to describe. I wish I would have, practiced saying it, but essentially your outside are, your inside are on your outside, and then there's this bag that's attached to them. And so that's where your waste flows. Instead of going from your mouth, into the toilet, it now goes into this either ileostomy or colostomy bag. And that is in an effort for your body to heal. So you just had this major surgery, everything sort of has to heal. And then usually the next surgery, which is what I had, is to sort of put you back together. And then that ileostomy is reversed.
Gotcha. Thank you. I know I hadn't asked you that question before. So if I'm hearing this right, then most people, that surgery wouldn't be as major. It's because of the Crohn's disease, there was just so much inflammation, right?
Yeah.
So, okay. So this was a little bit more on the exception side.
Yeah. A colon resection is usually standard. Depending on where your tumor is, they might not be able to do just a small resection. It might be more. If it's rectal, they might do the ileostomy or colostomy. It's very, this, I want to say researching your surgical options is one of the most important things you can do as a colorectal cancer patient. I mean, you got colon, you got rectal, you got anal, you got sort of all 3 different types of cancer that are in that area. And so things have changed over time. They couldn't do laparoscopic surgery necessarily. Even, this was 2012. I wasn't a candidate for it, but now it's done a lot more often and at a lot more hospitals. So the recovery time and healing from that is a lot easier than obviously if they have to open you.
Right. Absolutely. Is there anything else from this part that you feel is important to let people know about?
Well, I think, like I said, getting up, I was in obvious pain, as anyone would be that had had any sort of major surgery. But that next day after I had had my surgery, PT, physical therapy, came into my room and said, Allison, it's time to get up. The sooner you get up, the sooner you can get your NG tube out, the sooner we can get this drain out, the sooner we can get that. You got to get your bowels moving again. That's the whole goal of all this, you get to see something in your ileostomy. You celebrate little victories like that. And so that day 2, I was in so much pain that I was like, I'm not getting up. But then I remembered that if I did, I would get out there sooner. And so I remember I sat on the edge of my bed for a little bit, and they're super patient with you. I sat up on the edge of my bed, stood up, held my IV pole, and had my pain pump that well, actually at that point I still had the epidural, but it wasn't working on that one side, so I still had extra pain management on top of that. And I think I walked outside of my room and walked a few steps around, and then I went back in, but every day it gradually got better. But motivation for me was, I don't know if I was the youngest person on my floor. I would assume I probably was, but you see these older people lapping you on that floor. Everyone's trying to get out of there and everyone's trying to recover just like you are. So every day you see the same people. And I'm like, if that 60-year-old can do it, then I can do it. So really it was motivation from not only the PT and the doctors and myself, it was seeing others and how they progressively looked better and better each day that got me out of my bed daily.
I love that inspiration. You're like, I can't be lapped. That's wonderful. And so before we wrap the section on the surgery, and I know you had the subsequent one, but no matter what kind of surgery people are going through, do you have any sort of message, right? Because regardless again of surgery, your body's going through a major change. So yeah, just a message for people about that and dealing with that reality.
I mean, I think that you have to go in trusting whoever is going to be opening you up, right? Either laparoscopically or normally your body is going to go through changes. You're going to be in pain. Your body's going to have to get used to whatever organ has been affected. And I think just being patient with yourself is something I try to tell people, because you want to get better as fast as possible, and that's not the norm for most cancers, especially with colorectal cancer. When it involves your bowels and your bowel habits, that's a fundamental thing that we all have to deal with on a regular basis. And when someone messes with that surgically, it's not going to happen overnight. And I talk to people all the time. They're like, how does it get better? Does it get better? And I remember being that person asking others, does it get better? Does it get better? And it does. You just have to be patient and listen to your doctors and adhere to sort of what they're saying. And as much as I didn't want to get up and walk around, even when I went home after that surgery, I had friends and family come over and we would go for small walks just in the neighborhood, not only to get me out, but to get me moving, because you're in control of your body, right? And what you do to it and how fast you recover, part of it is out of your hands, but a lot of it is also in your hands. So I think being patient with yourself and your body is really important.
I love that. And so what I'm hearing is, very importantly, right, be patient, give yourself some grace. It's going to take time. It's a huge change for your body. And then the second part of it is, well, you can be up and moving if you can. That's one of the best ways of expediting that process. Okay, great. So you're done with the surgery. You're recovering. You're trying to get settle down. It says the second chemo, the adjuvant Xeloda, then started the following month, and then it lasted for a few months. Can you describe that general sort of schedule and what that was like?
I mean, it was the same schedule without the radiation this time. And at this point, I'm still recovering from my surgery and taking this chemotherapy, and nutrition and in eating was one of the most important things for me, because throughout those, the journey so far, I had gone, I think I lost 40 pounds. And so I, was having the normal neuropathy, skin changes, nausea, all that sort of stuff. You have joint, bone pain, all those changes you have with, most chemotherapies. But I also was trying to eat as much as I possibly could so that my body was healing. Because nutrition is key with all different types of cancer, but really I didn't purposely lose that weight. I was trying, and so my doctor was like, Allison, eat whatever you are craving, whatever you need. You need that nutrition to make you feel better. And so I listened to them, and obviously my diet is much more regimented now, but then they're like, we want you to eat, we need you to gain weight. So I remember, and I tell people this all the time, I don't really eat Skittles anymore because I had a craving for Skittles. So my mom got me a 5-pound bag of Skittles, and I would just eat them because that's what I craved. Also, Doritos. I craved Doritos, so she would get me jumbo packs of Doritos. Whenever I had a craving for a food, my mom was the best. She'd be like, "Okay, gone. I'm going to go get it right now." And I mean, I gained a little bit of weight back, but also I was trying to eat. I think with the ileostomy, like I said, your nutrition changes a lot. Either a lot of fiber, less fiber. I ate banana, rice, applesauce, and toast, the brat diet, quite a bit, just to get things starting to move. So gradually, I could introduce other things into my diet, but during that recovery period and subsequent chemo, it's really about, you know, healing. It's really about healing and whatever you can do to make that easier on your body.
Okay, absolutely. And by the way, you had mentioned the ileostomy. So was this something that you were dealing with day to day? Like,
Oh, yeah. Um, still deal with it day to day now with the permanent one, but I think that you have to adjust your diet. You have to deal with, you now have this external essential organ on the outside, and you have this bag that you attach to it. So you have to change that. Sometimes daily, sometimes every 3 days, sometimes once a week. You have to figure out what appliance, and I say appliance, it's the bag that you attach. It can be a one piece, it can be a two piece. You have to figure out what best works for your body so that you don't have leakage. Because if you can imagine, when you're eating, that waste isn't fully being digested because you don't have a part of your organ anymore, right? Part of your colon or your intestine. And so it can burn your skin, it can create irritation. So we could talk for another hour on an ostomy, ileostomy, colostomy, and all that stuff, but the main points I'll make is that try to find an ostomy support group that's either local or online. United Ostomy Association is one that I love, and there's a Houston Ostomy Association that's a part of that United Ostomy Association. And I went to those meetings, and sometimes you have people that have 30 years experience with an ostomy, and I would be like, "Well, what's going on? My food's moving through me too fast. What do I do?" They would give me tips and tricks I had never heard before. Also, you know, I was lucky that MD Anderson had a wound ostomy clinic. So I was in that clinic sometimes daily trying to figure out the best appliance for me, the best bag that would work for my stoma, because every stoma is unique. And so wound ostomy nurse, ostomy support group. And then you have all these companies that supply all the products. A lot of times when you call those companies, they'll send you free samples, starter kits, and also they'll have a nurse either with an ostomy usually, or just is a certified wound ostomy nurse or ostomy nurse that can provide guidance to you as well. So they're very caring. They really care, and they just want to help you.
right?
So it was a huge struggle for me, and I now am on a part of an ostomy support team at MD Anderson, so that when someone gets an ostomy for the first time, I go and I talk to them, because I had all these preconceived notions about it. And, we'll talk about this later, I'm sure, but my life is better because of it.
That's amazing to hear. And yeah, maybe separately we can do another sort of chat about that, because I'm sure so many people wonder. And it sounds like great resources you mentioned. So thank you. So since you went back onto the chemo, was there a scan after? Like, what was the next step?
I can't, I know that once they went in for surgery and they removed like all that stuff, and they said they had clean margins, this and that, I was essentially cancer free. And so after that every 6 months I was getting scans. So yes, after the chemo I had a scan, and everything was clear and everything looked okay. And then it sort of, went, I think it was every 6 months I had my blood drawn, so they get different markers, as well as, I'd have a CT of my chest, abdomen, and pelvis.
Okay. And is that still ongoing or?
Yeah, now it's yearly, but it was every 6 months for a while.
Okay. So happy to hear that things have been good, right? The scans have been clean.
Yeah.
Awesome. And I did see here you had talked about hair loss over many months leading up to October a
Yeah.
couple years later, a few years later. Can you describe what was going on there?
So I'm sort of a unique case in the fact that I had active inflammation from my Crohn's disease, and so I was put on some medicines that I think maybe 5% of people that are on that medicine lose their hair. So it was a combination of a lot of different medicines that made my hair fall out, and it grew back, but then it fell out again, and so I'm still dealing today with with it growing back. So I wear a wig on a regular basis. Most people know this. I don't know if everybody does, but most people know it. But but there are different things I'm doing now to try to have the hair grow back. I mean, when you go through your body goes through trauma and combined with different medicines, combined with a medical history like mine, unfortunately, my body just it was like, okay, boom, done. I lost all my hair everywhere.
Mm,
And slowly but surely things started coming back once I got off of most of that medicine, but it's a very, very slow process.
right. Thank you for sharing that. So it's just another situation where because you had the Crohn's disease and there was just so much going on. Yeah, no, okay, that makes sense. I do want to ask since, well, first of all, of course, we're so happy that your scans, number one, continue to be clean and clear. It's clear that you have made it one of your life's purposes to, help other people, which is amazing. So you get asked a lot of questions, I'm sure. Any other questions that people ask you that we haven't covered yet? I mean, we will go into the mental and the,
Sure, sure.
yeah.
I'm trying to think. I think that people want to know about their recovery time and when they can go back to work or if they should tell their coworkers or what. I think that I get sometimes a lot of questions about recovery time, and really, it's they say for some surgery, it's definitely dependent upon the surgery, but usually it's a few weeks, 4 to 6 weeks, 2 weeks depending on what you have, and I again when we say patience, I think don't rush back to a job or to doing certain things sooner than your body is actually ready to. Talking to your provider about what you can and can't do is really important. And another piece of the puzzle is and we didn't necessarily talk about it because I think it doesn't, sometimes it fits with people's treatment plans or not, but with the younger population, I I had the option to freeze my eggs at the very beginning of my treatment, but then I got very, very sick and that option went away. But I had to ask for that because there wasn't a fertility specialist at that time at my hospital. So I'm a very big advocate, and people ask me about should I do this, should I do that. If you're going to get radiation to your body, 100% you should look into fertility preservation, be it egg, be it they can move your ovaries out of the field. There's so many different things that they can do now that they couldn't do a long time, even 10 years ago, that they can do now if you want to have children in the future. But if you're young, you ask for that consult on that first appointment that you go to.
I love that you brought that up. I was actually going to ask about it because it's gotten better. I think more and more doctors are actually bringing it up now, or there's more awareness. But yeah, for a long time, and even still today, it's their number one priority is your medical care. So they're not like for me, my oncologist didn't bring it up either. I had to ask. So that's the message, right? Is there are certain things that you're going to have to advocate for yourself.
100%, and that's definitely one. I think no matter what age you are, you still want to have a quality of life after you've gone through all this treatment. And if that means you want to have a family, you got to explore all your family options, family building options before you start this long, arduous journey. Because for some people it's not as long, but for others it lasts for a very long time. And you want to at least know what you're in store for. And for me, it's something also that's emotional to talk about. But I didn't get to freeze my eggs because I got very sick, but I did have the medicine ordered, so it was an option to do, and they could have done it within 12 days. So it wasn't really too much time to have to wait before I started my cancer treatment. But But now, at this point in my life, I've looked into, foster to adopt and adopt, and different other options. And I will have a family one day. It is not going to be, genetic, and that might be good because my genes aren't very good.
So it sounds like you've really worked through a lot of these things and have come to a great place for you.
Yeah.
I mean, that's just a theme, right? I mean, cancer comes in, and first of all, you dealt with Crohn's disease, so you already dealt with something that had completely changed and shifted a lot of your life. Cancer, of course, is a completely different story, but what would you like to tell people? I mean, you get the cancer diagnosis, you think about the actual treatment, and then there's like actually the rest of your life. uh,
Yeah, I mean, you got to think about everything. My life has changed drastically since my cancer diagnosis. You got to think, like, really, I think I was still, even at 32, I was like the party girl. I was just having fun with life. And I finally had been like, okay, I need to meet somebody decent, settle down, have a family, and have all these hopes and dreams. And I think you have to think about long term when you're diagnosed with any sort of cancer. But really, I think, what do you want your life to look like? I think I just want to, have a long, happy life. And the things that maybe made me happy before are not the same things that make me happy now. I surround myself with people that I know care and love me and support me, and were there for me during my cancer journey. So I think, like we were talking about with the fertility, do you want to have a family? What job really makes you happy? Take care of your mental health. I mean, there's there's financial toxicity also that happens with patients, especially young patients that are just starting out their career or are in college or whatnot. So you've got to navigate the whole issue of insurance, and that dream house that you might have been saving for, that savings might now be going towards cancer treatment. And in the long term, you're alive. So where you're living, if it's not the big house, on the block, and it's a condo that is works perfectly fine, um, my attitude's changed about all of that.
Right. No, and you brought up also just now about relationships. Cancer impacting the relationships that were already in your life. So your parents and your friends. I mean, can you talk about that as well?
Oh, 100%. Relationships get tested a lot during this whole journey. When I was first diagnosed, I had been dating someone, and they left. They couldn't handle it. They're like, "Peace out, good luck." And so really, I didn't have time to think about dating and relationships at that point. I was like, okay, dive right into my cancer diagnosis. But there's people that were there for me throughout my journey. Some totally surprised me. Some people totally stepped up. Some people I thought would be there were not there. And then, my parents, they were my lifesaver. My mom was at every appointment. My dad was, by my side every night after I had surgery, along with my mom. And I think you realize the people that care about you and the people you want to have in your life and the people you surround yourself with. And it totally changes after, during and after cancer. And it's surprising that, a lot of those people that were there for me are still in my life, but I have a whole new, and we can talk about this more when we talk about advocacy, but a lot of my best friends are fellow cancer survivors, and people that I've met throughout my journey that I connected with for support. And those people just get me like nobody else. And so a lot of them don't live here, they live all over the world, but they are some of my best friends and true friends, and I know they will be my friends for life.
I love that, right? It's a bond that is inexplicable. You've been through something that's a shared experience. I like that you're bringing up support, right? So there's the advice of, you will find out the support from your existing circles, but also go and find other circles of support,
Yeah.
right?
Oh, 100%. Like when I went to my psychologist, I was like, are there any support groups out there? And so, yeah, I went to the ostomy support group. That was great. But I really wanted to connect with other young adults like me, other people like me. So they told me about some nonprofits. I got involved with some of those. There's a ton of colorectal cancer nonprofits. The first thing I did when I, was trying to find some locally, I was like, colon cancer support, Houston, Texas. And that's when I went to Google. Google's good for that. So I found out about a race called the Get Your Rear and Gear Houston through the Colon Cancer Coalition. I was like, great, I want to meet other survivors like me. So it was a way for me to meet other, patients and survivors, but also give my support system, the friends and family that wanted to do something for me, that there really was nothing for them to do, to be there for me on one day, because it was sort of during my treatment that I did that. But also there's ways to connect online to other patients and survivors. There's an online, support system for colorectal cancer patients called Blue Hope Nation through the Colorectal Cancer Alliance. There's something called Colon Town. And essentially that's where you can connect with other patients and survivors and caregivers and people that just get you, but also local support groups. So I, like I said, there's so much advocacy that I do now, but there was a group called Cancer 180 through MD Anderson, and it was specific for young adults 18 to 39, no matter what type of cancer. And they do every other month, they have like a social where you get to know people. So I
Right.
dragged one of my friends with me to the first social, and it was happened to be at the zoo in Houston. I love animals. So we go to the zoo, we meet other people, and then we go to this dinner where you connect with other people. And so it was the first time I'd ever met a young adult, besides on the phone and besides some of the people I talked to one on one in person. And so that sort of changed the whole trajectory of my life for the better, because then I got involved heavily in the adolescent young adult movement by joining a young adult advisory council at MD Anderson. And through that, my experiences, my good and bad, they listen to the patients, and so they take them to an account. And I remember saying, okay, is there a young adult support group? We have this young adult advisory council. And they said, well, no, we have one for the pediatric patients. Maybe we should do one for young adults, like you said. So I had this idea, they took it and ran with it. And they're amazing social workers, they're amazing people that are in charge of this Cancer 180 program, made it happen. And so that young adult support group, I think, is a little bit over 5 years old now, and
Mm,
I still go to it to this day, because
that's great.
I think no matter where you are in your cancer journey, the support doesn't stop just because you're maybe cancer free, because survivorship and the long-term side effects are sometimes when the true test of you as a person start.
Right. No, I couldn't agree more. It looks like, I mean, thank you so much for all this time you've given us. My last question to you is just, what is open-ended? What's your message to people? And a lot of people who are watching this are newly diagnosed patients and caregivers, and who are reading your words. So yeah, any last message?
My last message is you're not alone. I thought I was alone when I first started. I looked around the waiting room and I didn't see anyone that looked like me. But if you search and you reach out to, people like you or people like me, we can connect you to the resources you need and the people that will help you throughout your journey. Because even though you're surrounded by your amazing support system of friends and family, you can get very lonely at times. But when you can connect with someone else that gets it and gets you, then I think you really can get the support that you so badly need to get through this journey. And it's also one day at a time. Nobody's journey is the same. So what you might struggle with, someone else might not struggle with, but you're not alone, and taking it one day at a time are those lasting messages that I can give anybody.
Perfect. Allison, thank you so much for sharing your story and spending so much time with us. We really are grateful for it.
Of course, I'm happy to be here, and I just want to reiterate, I am happy as an advocate to help anybody with anything. If I don't know the answer, I can send people in the right direction to find the resources they need.
Perfect.